Now we take a look at crystals. The crystals, well, we have in the urine, you find calcium oxalate. And with calcium oxalate, well, it might be a square that you're finding, or you might have heard of a coffin type of appearance in your urine. You know what a coffin looks like? Which you basically place your patient, my apologies. If a family wishes to bury their loved one, you put your loved one in a coffin. That coffin shape that you might find as a crystal in your urine will be then associated with calcium oxalate. And I'll show you pictures upcoming. Pure vegan diet, ethylene glycol is a big one. And then calcium oxalate stones is what we're looking at. What's the most common type of renal stone? A calcium stone. Calcium oxalate being right up there. Crystal. Uric acid will give you crystals. Hyperuricemia. Two big ones here. Maybe gout. And who's your patient with the gout? Most likely a male who's been drinking quite a bit and maybe perhaps is not drinking enough water. May result in uric acid crystals. Massive destruction of your cells. What's happening here? Well, you tell me about cancer and chemotherapy. Is cancer made up of DNA, the cancer cells? Of course they are. What does DNA mean to you? Purine, pyrimidine, purine, pyrimidine, purine, pyrimidine. Now, this patient has cancer receiving chemotherapy. Are we together now? That chemotherapy is causing what? Massive destruction of your cancer cells. What's it doing? Oh, this is uric acid. Where is uric acid coming from? Purine, isn't it? So therefore, this is called tumor lysis syndrome. It may result in excess uric acid in your urine. You may have decreased pH and uric acid crystals. Triple phosphate may be a sign of urinary tract infection due to urease producing uropathogens. Give me an example. Something like, good, Proteus rhabillus, urease. Cysteine. Our discussion earlier, we had talked about different types of malabsorption, especially in the proximal cavity tubule. And at some point in our discussion, we talked about Hartnup disease, we talked about Fanconi syndrome, and we talked about cysteine stones. And at that time, I gave you a mnemonic called COLA. C, cysteine. O, ornithine. L, lysine. A, arginine. Didn't I? I sure did. And during that time, this patient is unable to properly reabsorb cysteine, results in these beautiful, clear, amazingly hexagonal crystals. Welcome to cystinuria.